Now let me throw something out to the audience here. I want by raise of hands. If I told you there was a way to decrease your risk of having a heart attack or stroke by 75% without medication, how many people would go for that? Anybody? Yeah, I would also. And the one takeaway point is there is a way to do that. It's how we eat. If you stick to the Mediterranean diet, 75% decrease in the incidence of having a heart attack or stroke. I didn't make that up. Dr. Oz didn't make that up. That's real. There are studies that show that. And the bottom line, you want to take away one point, it's the Mediterranean diet. It's throw out the processed foods. Turkey, chicken, or fish. Vegetables, fruit, put in some olive oil, put in a lot of olive oil there. Water, throw away the carbonated beverages, and do a little bit of exercise. That's the key. Instead of breads, go to whole grain, get rid of the white bread. That's the bottom line, 75% decrease in the incidence of having a heart attack or stroke. So everybody can relax. Just remember that point. Throw away the processed foods. You do that, you're good. You do the exercise and you'll feel better. That's the bottom line. Now, what I'm going to spend just a little time on some basics, high blood pressure and high cholesterol. Are our children safe? The question is, are we safe? But who's the people at risk? It's not the 10 or 20-year-old. It's the person like us who are a little older, 40, 50, 60, 70, 80, 90. We like to say in our office, who is a senior citizen? Does anybody know who a senior citizen is? Number one, if you think you're a senior citizen. But number two, we do not give out any senior citizen cards in our office unless you hit 85. 85, you start to be a senior citizen. But on that, you're just getting a little older. So we're going to talk a little about that. What are the risk factors? What are the risk factors? We have to ask ourselves, what are the risk factors? Number one risk factor is always aging. But you think about obesity, high lipids, diabetes, smoking, lack of exercise. Those are the key things. What can we do to help ourselves? What we can do to help ourselves is exercise. As Dr. Young was saying, you have arthritis. The best treatment for arthritis, you know what it is? Get out there and exercise. Do exercise. And I recommend looking again at that pamphlet we have for free in the booth out there. Now, we talk about blood pressure. Blood pressure is the key, and it's simple. It's simple blood pressure. Salt is the enemy. Salt is the enemy, number one. We should be sticking to less than 2 grams of salt a day. Number two, one of the easiest things you can do for yourself is what? Buy a blood pressure kit. Simple blood pressure kit. Take it to one of the doctors. I see Dr. Rothschild in the office. Take it to his office. Let him check your blood pressure, correlate it with what he gets. You have a way to check your blood pressure. You have a way to check your blood pressure, and salt is always the enemy. Salt is always the enemy. Lifestyle modifications. Weight, exactly right. Weight reduction. You don't have to lose 80 pounds. You lose 5 or 10 pounds. You're starting in the right direction. Weight reduction, number one. Number two, diet. Diet is the key. Get rid of the processed foods. When you get rid of the processed foods, you're getting rid of the saturated fats. You're getting rid of the saturated fats. You're getting rid of the trans fats. Sodium restriction. Sodium is the enemy. Get your salt less than 2 grams. Exercise is always the key. Exercise is always the key. If you're in a wheelchair, you can exercise. And if anybody wants, I'll show you how you can exercise in a wheelchair. And you can do it. You can do it. The last thing about limiting alcohol. People say, I have to drink red wine because red wine has flavonoids. You know what has flavonoids also? Grape juice has flavonoids. And the flavonoids, which are the antioxidants that decrease inflammation, they're just as good in the grape juice as they are in the red wine. So you can drink grape juice. And one of the key things we want to think about when we talk about all this reduction, what we're really trying to do is take our body, shift ourselves from an inflammatory state into an anti-inflammatory state. Our blood vessels when we're born, this is a large blood vessel. It's like Teflon. Nothing's going to stick on it. Nothing's going to go through it. That's what we want to do. As we get older, we get blood pressure, we get cholesterol, we get age. It starts to become sticky. It starts to become a little rough. And things sit on that blood vessel. And that's how you get a heart attack. Plaque sits on there. The plaque cracks. You get a clot. You have a heart attack. 75% decrease in the incidence of having a heart attack or having a stroke if you sit with this diet. The Mediterranean diet, simple Mediterranean diet. Does it reduce risk? You don't have to believe me. Everybody can pick up, it's actually this week's JAMA, Journal of the American Medical Association. Look at that and they'll show you what the Mediterranean diet actually does. And I'm not going to go into all the details. Does it reduce the risk of heart disease and diabetes? It certainly does. Reduces the risk of diabetes by about 15%. Reduces the risk of having a heart attack by about 75%. And it's more effective. There is no medication whatsoever that is as effective as the Mediterranean diet. That's the key thing. no medication. 75% decrease in the risk of having a stroke or having a heart attack by just going through the Mediterranean diet. Decreases blood pressure, decreases cholesterol, decreases glucose, decreases weight gain, everything we want to do. Interesting article. Alzheimer's and Parkinson's are decreased if you go on the Mediterranean diet. I've got early Alzheimer's, I believe. My kids tell me that. I've been on the Mediterranean diet. Also, importantly, because you only want to remember what you want to remember, cancer. There's also data that it decreases the risk of cancer. It decreases the risk of cancer. The Mediterranean diet clearly decreases the risk of cancer. So, heart disease, major risk of premature death. No question about that. We got to take care of our blood pressure. We got to take care of our cholesterol, decrease our risk of heart disease. Now, what I'm going to do is just in the last 2 minutes show you what the Mediterranean diet is. It is not the war on delicious. See, Time magazine showed a piece of pastrami, a piece of bacon, and say there's a war on delicious. No, it's just a type of delicious. There's tremendous amount of good food that we can eat. And you can see it there. There's fruits, there's vegetables, whole grain breads, turkey, chicken, fish. It's all out there, and liberally, as my neighbor Gianni Tosa says, sprinkle or put a lot of olive oil on that. Olive oil is an excellent antioxidant. Hard to see the food pyramid, but look how good that food pyramid is. Look how happy everybody is over there. And we're not going to get into the details of the guideline of the specific diet, but really the key point is this. They talk about the war on delicious. There is no war on delicious. There's a war on bad foods. We have a war on salt. Cut the salt down, cut the fat down. No matter what age you are, you exercise. That's the key takeaway point. This is one of my idols. I don't even know who he is, but are there any questions? I'm going to finish up with this. You got a question? You raised your hand.
There's things that have been going out now that red meat causes cancer. What are your thoughts?
Red meat does cause cancer. It's the nitrates and nitrosamines in red meat. There's an individual named Stanley Hazan. Stanley Hazan has been at the Cleveland Clinic for about 20, 30 years, and here's his philosophy. If you take red meat, any type of meat, or certain milk products, they've broken down, they go across our gut, and they're broken down to something called trimethylalanides that get oxidized in our liver. What does that mean? It becomes an inflammatory process. Now, Stanley has been trying for the last 20, 30 years, and God bless him, he's one of the greatest scientists in the world, how to block the absorption of those bad things. We're not there yet. But red meat, large amounts of red meat definitely can cause cancer. No question. Large amounts of red meat can cause cancer. You just need to stay away from that. Once a month is not going to hurt you. If you want to eat meat once a week on the Sabbath, or whatever day your Sabbath is, whether it's Friday, Saturday, or Sunday, eating red meat on that day, if it's once a week, you're okay. As long as the other 6 days you stay away from processed foods. That's the key thing. Stay away from processed foods the other 6 days, and we're going to be good. Now, I just want to thank, because we're going to stop here, we have a beautiful, beautiful buffet. So I want to first of all thank Minash. I want to thank Peregrine Landing here at Tudor Heights, Sherry, the whole staff, for everybody for really making this happen. Quick question. Potato kugel is a processed food. There's generally a lot of salt in the potato kugel. One of the key things, if the worst thing you did in the week is have a piece of potato kugel and a piece of cholent, you're okay. It's the one day a week is okay. It's the 6 other days a week that are key. So whatever day is your holy day, Friday, Saturday, or Sunday, that's the day you can cheat a little. The other 6 days, stay away from processed foods. We also want to thank tremendously Rabbi Katz for giving his talk and for being here and for lending. We want to thank all the speakers. I'm just going to go over Dr. Glicksman, Dr. Young, Dr. Matt Goldstein, my daughter Shana. We want to thank everybody for really attending. We want to thank and we hope to do this. We want to thank Avram Klugman. Avram, take a bow up here. Yossi Cotton. And I want to leave out one thing. We don't want to leave out, we want to thank Beth Abraham. We have our president, Ken Lassen, here for sponsoring for this. And we hope to do this, and we hope to improve the health of the total community. So thank you very much. Menashe is going to come with the buffet. And thank you. Have a great week, a great night, and a great week. Thank you very, very much.
First thing people want to do is walk over the wall.
They know I like this.
You get the wires out of the way, please.
That was very nice. Thank you.
Thank you.
Since I saw it,
Well, we'll post it.